support of the needy are public concerns and shall be provided by the state. Here are some important points to make when speaking with your elected officials. In these difficult economic times, please help needy families make the transition from welfare to work by providing the basic supports they need. Keep the state's commitment to increase the public assistance grant over the course of the next 2 years. This grant increase, which had not occurred in 18 years until last year, is now slated for delay. That is unacceptable. Continue to provide funding for programs previously included in TANF funding. Eliminating funding may achieve short-term savings, but will ultimately result in greater long-term cost. Health care is one of the supports families need to survive. Our church teaches that health care is a basic human right, and that ensuring affordable and accessible health care is an urgent priority. But the proposals in the governor's budget would reduce payments and increase assessments on health care institutions, hospitals, nursing homes, and home care agencies, to the tune of almost $1 billion. Revenue losses of this magnitude will lead to caregiver layoffs, reductions in programs and services, delayed improvements to facilities, and possibly even more closures. Make no mistake, loss of revenue for healthcare providers hurts the sick and the vulnerable. Particularly hard hit are the frail elderly and people with disabilities. The elderly are a large and growing segment of our population. They are least able to shoulder the burden of budget deficits. They have contributed to society the longest and should be disproportionately sheltered from the harmful effects of any budget reductions. They need coordinated comprehensive care planning to ensure they receive appropriate services, especially because shrinking resources are available for institutional care and greater demand is being placed on home and community-based care. Catholic hospitals, nursing homes, and home care agencies carry on the healing ministry of Jesus Christ, providing holistic and compassionate care to hundreds of thousands of people. Yet under the proposed executive budget, Catholic hospitals would lose about $40 million, Catholic nursing homes $19 million, and Catholic home care agencies $12 million. The state has an obligation to provide services to the most vulnerable. Urge your legislators to restore adequate payments to all providers and to require comprehensive care plans for every nursing home eligible Medicaid recipient. This will ensure that their medical, social, and spiritual needs are met. Our fifth issue for Public Policy Day concerns an investment in the education of our children. There are currently more than 500 Catholic elementary schools in New York State and 123 Catholic high schools. These schools combine academic excellence with spiritual growth and an atmosphere of respect to prepare young people for the world ahead of them. Combined with other religious and independent schools, they are responsible for the education of 500,000 children. Unfortunately, the economic downturn, rising property taxes, and the failure of the state to fully reimburse Catholic schools what they are owed for mandated services has led to a dire situation for many Catholic schools. More and more Catholic schools have been forced to close over the past decade. They are in economic crisis, and more will close unless action is taken quickly. The failure of state lawmakers to fully reimburse religious and independent schools is costing these schools $243 million. That's about $500 per student. A new MTA payroll tax is costing religious schools $6 million. The governor's budget recommends $60 million to reimburse public schools for this MTA expense, but zero for religious and independent schools. Catholic and other religious schools save the state $8.5 billion a year. Catholic school closings result in increased burdens on taxpayers and an overcrowded public school system. urge your lawmakers to uphold New York's legal commitment to pay 100% of mandated services costs for Catholic and other religious and independent schools. Tell them that justice and equity demand that families with children in religious schools receive a fair share of government support. Implore them to reimburse Catholic schools the monies that are owed to them. Our final issue for Public Policy Day is community reentry. Last year, the state legislature took significant steps to scale back the Rockefeller drug laws, which required mandatory imposition of stringent prison sentences for many nonviolent low-level drug offenders. Now the state must invest in comprehensive rehabilitation programs and community reentry planning for those who are released from prison. Formerly incarcerated persons often have a difficult time finding and keeping jobs. That is why education, job training, and skills development in prisons provide tools needed for successful reentry. Many persons who enter the criminal justice system have alcohol, substance abuse, and mental health problems. They need treatment programs in prison and upon return to the community. There is growing recognition that treatment works. They also need connections for employment, housing, and other support systems on the outside. Most of those incarcerated will return to the community. Planning for successful reentry must begin early in prison. Urge your lawmakers to provide drug treatment programs for nonviolent offenders, and remind them that successful reentry benefits both the individual and our community. Thank you so much for being a part of Public Policy Day 2010, Catholics at the Capitol. While it's easy to get frustrated and cynical about the state of politics today, try to remember that politics is, at its core, a noble pursuit. It's about doing good for society. As Catholics, we are called to be a part of the public discourse and to bring our values to bear on the discussions taking place, always connecting our citizenship with our discipleship. We hope you will continue to advocate in your own community, visiting your legislators in their district offices, starting a public policy group at your parish, and using our website, nyscatholic.org, to communicate with lawmakers easily and efficiently. Thank you again.
This has been a presentation of the New York State Catholic Conference.